Just first of all, Minister, there were reports from the British government yesterday that they distributed 400 million items of PPE within the last fortnight. How much of that did we get?
We haven't received any of that as of yet, but we are on that supply chain, so that is all on the way to it. Connor and I had a meeting yesterday, so there's been a communication put in, and I suppose in regards to PPE, where we're looking for our supply chains is what's available from the United Kingdom. Also in the partnership with the Republic of Ireland, and it's that piece of work that Connor and I, the two departments, are working together to make sure we're plugged into that order that's coming across from China. From China as well. But also the third part, and it's mostly Connor's department will be taking the lead in that, is what we can produce and manufacture here locally. So the likes of O'Neill's or Block Blinds is where we can actually tap into your own local manufacturers. So nothing, in response to nothing has touched down as of yet, but it's on its way. The order was put in, and that order's being processed now.
So just to be clear then, out of 400 million items that were distributed in the last 2 weeks by the British government, we haven't received one single item?
That's what I'm saying, it's in the process of coming here. We still have our own stocks and supplies, and what I wouldn't want to do here is get into any sort of political discussion about who has supplied or who hasn't supplied. The order is in, Connor's aware of what I was working with, and we're talking about that, and it's on its way. It's not that it's been denied to us, or it's not that we haven't got it. It is not. It's in the distribution chain.
You know, I was listening to Pat Cullen on the radio this morning, and she was complaining that nurses in acute hospitals and community nurses are still experiencing shortages of PPE. So if the British government are distributing 400 million items and we aren't getting any, then there's a problem there somewhere.
Pat, in regards to that, that's what I was saying earlier on when we had the conversation with Pat yesterday. You know, we're aware of there are, and this isn't the fact that the PPE isn't arriving from the UK. It's the fact that we still have challenges within our own supply chain here as to how we get the appropriate PPE out to those who need it at the point of time they actually need it. So that's the challenge we have here. We have currently no physical shortage in our current stockpile. And we're pushing that out through the trust, through the care sector as well, to make sure that PPE is there for the people who need it at this minute in time. So we are receiving reports of individual wards and nurses and doctors not having the correct PPE. But as the reassurance is there, the PPE is in the chain. It's just our challenge is actually making sure that trusts get it to those people who need it on time.
Well, if there's no shortages in the supply line here, then you should take that up with Pat Cullen and the RCN. But in any event, I'm sure others will want to come in on the issue of PPE.
It's the conversation we actually had. We had a good conversation with Pat yesterday in regards to PPE. So, you know, we're fully aware of this. It's a job of work. We're actually working well with the unions on the RCN as well, because, you know, made it clear when I was talking to Pat yesterday, if she had any specific issues, we're open for those conversations. And look, we've a good communication flow with them.
Okay, fair enough. I want to move on to the issue of testing. And I mean, it's been clear over the last 3 months, from early January anyway, that the guidance from the World Health Organization, more recently from the ECDC, was to test, and the test, trace and isolate. And the date that hasn't been happening here. Now, I note yesterday, Michael Gove says there's a need to go further and faster, and Boris Johnson also said yesterday that testing will unlock the puzzle of the crisis. Where do you stand in all of this, Robin, in terms of testing? Because, I mean, I'm sure you would agree that testing has not been a priority to date.
I would actually disagree that testing hasn't been a priority. We've been pushing to try and get our testing capabilities up as hard and as fast as we can locally here, Pat. Now, we always have to remember that, you know, from a disease that was initially identified in December to where we are now in our testing capability. We've pushed it. We haven't pushed it as hard or as fast as I would want to have to been, but we're seeing every day we see changes and developments in our testing capability. And I think, what Michael Gove and Boris was talking about, as we move to the antigen testing, where we can test people who either have had COVID-19 or got through it, so that's why we're looking, that's why, as I said, even in my opening comments, we're looking at the MOT centres and we're looking at actually that development down at the Odyssey. So when that ability comes online and we are able to ramp up, we can complete that. So in my opening comments I said, look, and I suppose just to make the committee members clear, at this minute in time, we're pushing our testing capability, which was mainly based in the Belfast Virology Lab. We've now pushed that out into a number of trusts and to actually the ambulance services as well, so that there's testing going on across the health estate. The current work that we're doing and pushing into is actually pushing into our AFB labs. But when I say, sorry.
Asking you is, what are the problems thus far that have ensured that testing hasn't been taking place at a rate that would be desirable?
Sorry. Look, I suppose the challenges that we've had locally and the number of tests that we've been able to do is actually the availability of the products and the supply chain themselves. So when we were starting off with the small capacity we had, we were able to manage that and keep it up. But as we've ramped up, there has been challenges. Even in regards to the reagents that are available, and I think even the labs in the Republic of Ireland are seeing that as well. The other thing as we ramp up is make sure that the staff that is actually doing this has the appropriate training and accreditation. So, those challenges have all been something that we've been working through. So as we ramp up, as at each stage, as the health estate has been ramping up its testing capability, is because we've been overcoming those hurdles that we've had in-house. And it's also been trying to, when we've been trying that, there's been a lot of talk, about the commercial tests that were available and why we were not just buying those off the shelf. We were waiting to make sure.
Are you worried about that, Robin? What would prefer?
It's hard doing this over the phone because as you know yourself, if you're sitting at the other end of a committee table, it's far easier to see where the answer's going or whether that's the direction you want to take.
I suppose what I'm asking is, we knew from early January when China was screaming about what was coming down the tracks at us, and to a large extent it was ignored. It was ignored in Italy, and only when the number of infections and the number of people dying began to rise exponentially, Italy started screaming too about what was required. And the most successful countries to date have been in Asia, in South Korea, in Singapore, in Japan, and China itself, where there has been large contact tracing and isolation. And one of the reasons there's an absolute need for testing on as wide a scale as possible is that many of those who are carrying this infection have absolutely no symptoms whatsoever, which means they can be out and about in the community spreading the virus further. Now, we knew in early January what was coming down the tracks at us. What preparations were put in place from then, and how have they been ramped up since then?
In regards to the point you make about isolation, Pat, and that's one of the things we did at the very start, and I think that's the proactive step we took. When we were telling anybody who thought they were symptomatic or were showing symptoms, actually to self-isolate. So what we were taking even at that early stage was asking those people who were asymptomatic or symptomatic to actually take themselves out of the general public and out of the wider public to prevent the spread of that. And I suppose that's in regards to what we've been actually doing and what we've been actually enforcing and asking people to do over the past number of weeks is the isolation that we're actually having at this minute in time and the social distancing. exactly that aim. So we remove not only those who are carrying COVID-19 and who are asymptomatic, but also those who are vulnerable and may be more susceptible to suffering in the worst cases. Should they contact it, to take them out of the system at this minute in time. So the steps that we're taking now will have that impact and that effect as to stop the further spread of COVID-19. So that's why we're preaching. That's why we're asking people, observe the social distancing. When you can't stay in the house, stay in the house, and prevent the spread of this virus getting any further within the concepts of Northern Ireland.
Testing on a very small scale, and the CMO himself said probably over a week ago now that there were probably thousands out there who are infected. If we weren't doing testing on a large scale, how do we know where the virus is? Do we know where there are any clusters?
We're working to this minute in time, Pat. That's why we're asking everybody to stay in the house. In regards to the testing, we're targeting the testing capability that we have. Pat, I said in the early situation and early I want to see as much testing in Northern Ireland as we can practically and physically do. That's why we're pushing this. That's why we're ramping it up. That's why we're challenging across the government departments, across our private and public sector, and our universities to bring them online. And we're also part of that greater, the UK wide contract in the testing capability that has engaged our commercial sector. So it's not that we're ignoring it or we're not doing testing. We're pushing here to get as much testing as physically possible up and running.
But Robin, let's deal with the facts. There was resistance, particularly across the water, to the initiation of a large-scale testing exercise. Is that not the case?
Paul, I'm not talking about what happened across the water. I'm talking about what we did here.
Are we not following the lead from there?
No, we're following our own lead. We're doing our own thing here. We're taking guidance from the Chief Medical Officer who works as part of that UK-wide the Chief Medical Officer, and they come and gives guidance and advice to us. So that's why we're pushing. That's why.
You see, Robin, that's why I'm asking you to explain the steps that have been taken since January, since we knew about this. And given that we know what has been happening in other countries where they've been able to suppress the disease, that they have carried out large-scale testing. Germany at the minute is testing 500,000 people a week. I'm asking you, how many more test kits have been procured since January? How many did we have in January and how many do we have now? There's still a relatively small number of people here being tested. Yesterday it was 565, despite there being a target of is it 11 or 1,400?
Our target and our push is to get up to 1,100, Pat. And that's where we're pushing to do that. And it's not something that we're ignoring, and I don't want you to try and portray that the Department of Health is not focused or targeted in trying to push up the numbers of people we're testing, because I think that's unfair, because that's where we are concentrating, and that's what we want to do. But we have to focus the tests that we have.
I'm not saying that. I'm saying there doesn't appear to have been any preparatory work done in the last 3 months to ensure that there was a process of large-scale testing of the population. No, there doesn't. I'm asking you now, how many test kits did we have in January, and how many do we have now? How many have we procured since January? What other training has been done to ensure that the virology lab will have sufficient personnel to carry out the tests? Is the virology lab open 24 hours a day? Or my understanding it's still only operating on a 9 to 5 basis. Is that true?
But as I said earlier on, where we're pushing is about capability of the equipment that we have as well, and the number of cells we can run at any one time. So in regards to the testing of individuals, there's a small pool of people who are working in the virology lab, and that's why we're bringing in and seconding and working with other people from across AFBI, from across the departments, and now pushing that out into the trust as well. So this isn't, and I suppose one of the things in regards to testing, it's not just something you can take or somebody you can bring in from I suppose an ordinary lab and set them up and get them running. It takes time, it takes accreditation, because we want to make sure that the tests that we're putting out and the results that we're putting out, we can actually rely on them being valid as well. Because the worst thing that could actually happen is you could say to somebody that they don't have COVID-19 when they actually do, and we could be putting them back out into society where they could be actually spreading the virus.
Okay. And finally, I mean, this isn't just me who's saying this. There are experts out in the field in epidemiology and infectious diseases and public health, people like Gabriel Scally, Alton Power, who was on the radio this morning, Michael J. Rand from the World Health Organization, Professor Sam McConkey in Trinity in Dublin. All of these people are crying out for more testing, test, trace and isolate.